Hi, on occasion of World Heart Day, that is 29th of September, I wish everybody a very happy and healthy World Heart Day. I am Dr. Swapnil Deshpande, cardiac surgeon from Dr.K.G. Deshpande Memorial Centre, Nagpur. Actually, this is a very interesting topic which we are discussing today, and there are a lot of myths and a lot of beliefs amongst all of us regarding what is the effect of COVID on heart disease on heart. It has been very well documented that with the incidence of COVID, the incidence of heart disease has also gone up. But it does not mean that you are always have to be very frightened about it. Your proper knowledge and education and proper medications taken at right time will definitely help you in avoiding heart diseases along with COVID. So the first and foremost is with the incidence of COVID, the heart diseases and heart attacks have gone up. And the basic cause for this is COVID has increased the formation of clots in the blood vessels. It is not just heart attacks, it is also blood clots present in the hands, present in the legs, present in the abdomen, present in the brain, and they have led to many problems. Many patients have lost their hands, many patients have lost their legs, many patients have had strokes or paralysis, and many patients have got their heart arteries clogged because of clots, and that's why they have had heart attacks. It has been found out that immediate intervention, that is angioplasty or putting a stent in such patients, has been very disastrous, and patients have not been able to make up after the heart attack and undergoing angioplasty. So it is always better to give a proper systemic therapy in the form of thrombolysis, in which we put up a drug inside the body, and that causes the breakage of these clots and releases the blood supply to the heart vessels, and that most of the times has been found life-saving for most of the patients who have undergone heart attack when the patient is COVID positive. Now, the second term is when the patient has been treated of COVID and later on the patient has had a heart attack. In these patients also, many patients have had blood clots as the cause of heart attacks. And the avoiding such heart attacks is taking proper drugs if the patient is having have had severe symptoms of COVID. If his COVID CORAD score has been more than 14 or 15, it has always been a practice to start blood thinners in the form of newer oral anticoagulation agents, with which these clot formation have got reduced, and hence these patients have got benefited in prevention of heart attacks after COVID. It is always better, but these drugs have to be prescribed by a doctor and should be in close monitoring with your cardiologist. Because once the patient is on oral anticoagulation agents, the blood of your body becomes thin, and these cause increase in bleeding tendencies. You might bleed from the teeth, you might bleed in your abdomen, you might bleed in your joints, you might bleed in your brains, you might have severe acidic problems because of bleeding and because of ulcers. So it is always under maintenance and always under the therapeutic guidance of a physician. If that will prevent heart attack in patients who have had COVID. Third problem is because of lockdown, there has been lot of inertia of people getting outside of the house, and that's why their exercises and all have been hampered. Many patients are coming to us with the problems of having breathlessness on walking, which has started after lockdown. So because they have been inside their homes, frightened to get out, and reduced exercise, increased intake, increased obesity, and that has led to lot many patients having more and more heart problems. There is a proper correlation between lockdown and heart diseases because of lack of exercise, and that's why we advise the patients to start exercises and then start exercises in a gradual and graded manner, and not when very haphazard or very excessive manner. Because if you do in very haphazard or excessive manner, that can lead to immediate heart attacks at times. Not for everybody, but some susceptible individuals can have heart attacks because of that. Thirdly, uh, there is an increased incidence of thrombus formation, that is clot formation, in many of our patients who have had a valve replacement problems, underwent surgery previously, and now they have COVID. Because of COVID, because of the increased formation of clots, these clots have got lodged up into the valves, and they have got called wall thrombosis, which has caused obstruction of the valves, and they have led to sudden cardiac deaths or severe compromised breathing problems. And patients have come to us in emergencies and have landed up into redo surgeries. So these are the problems of COVID and heart, in which there is immediate problem of clot formation. So that's what you have to keep in mind, is that there is a chance of heart attack, there is a chance of clot formation, there is a chance of a wall thrombosis, and that has to be treated very, very aggressively. But at the same time, it has to be under a therapeutic guidance, and you have to try to reach the doctor as early as possible.